Many patients have asked me about tympanic membrane repair surgeries. This tympanic membrane repair surgery is performed for those who have a perforation in the eardrum, which is usually due to an acute middle ear infection that was not properly treated. This leaves a hole in the eardrum. Because of this perforation, the patient always complains of not hearing well. His ear whistles and sometimes discharges pus from time to time. We need to do a hearing test before performing the surgery, and after we make sure that the problem is only in the eardrum and there are no other issues in the ear, we proceed with the surgery. The purpose of this surgery is to take a graft, whether from muscle or from the membrane of the muscle located above the ear. If we open the ear, or nowadays, we can take a piece of cartilage from in front of the ear. This also does not affect the shape of the ear, and we use it to make a graft that we place behind the eardrum so that the eardrum can heal over it. Because the problem with the eardrum is that it is exposed and there is nothing behind it for the body to build on, so healing becomes difficult, especially if the hole has been there for a long time. The goal of the operation is to place a graft behind the eardrum. This graft supports the healing process of the eardrum, and God willing, everything turns out well. Hearing improves and the ringing and discharge stop occurring. Now, this operation can be done in several ways. One way is by making an incision behind the ear and placing the graft. Another method is done with an endoscope without making an incision. We insert the endoscope through the ear canal itself and perform the operation from inside. This operation is not very painful when done with the endoscope. Of course, things are much better after the operation, but it's forbidden to fly or let water enter the ear until the eardrum heals. The hearing results are good as long as the problem is only with the eardrum. Wishing you a speedy recovery. If you like these videos, please subscribe to the channel. Leave us the comments with the questions you'd like to ask. What do I reply to? I reply to the comments that we receive. Wishing you all the best.